So then I was forced to make a decision. And the decision was either go back into private practice or do it, girl, on your own. And if you put me between a rock and a hard place, the hard place is going to lose because I'm coming out fighting. I'm screaming from the highest mountaintop. We need to bring awareness to our seniors and long-term care facilities because it's like they're a forgotten population and it's making my heart break. I tell people all the time, the mouth is the window of your health. If you think about it, when you go to the doctor, he looks in your eyes, your mouth, and your ears. You could tell a lot about your health just from your mouth. So if someone's mouth isn't healthy, their whole body is not healthy. That's just how it adds up.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 214. My name is Andrew.
Yeah, it is. And this is Michelle.
Not 1 hour ago, I said, hey, let's change up how we're going to be doing this. And then I'm like halfway through my little spiel. I'm like, oh, crap. Already screwed that one up. So I meant to say something about the fact that this is a dental podcast. We have Sonya Dunbar on today. I also made fun of Michelle for not being able to say names. This is the worst ever. I quit podcasting. It's the end.
I'm just so thankful that we bring guests on and we're not the smart people.
Ain't that the truth? This is going to be a great episode. Everyone, thank you so much for listening to us and taking time out of your busy lives to hang out with us for a little bit.
I keep telling people, they're like, wow, you have over 200 episodes. I'm like, yeah, but that's not us. Like, yeah, okay, we produce it and like we have some consistency in our bones, like We're doing it. But the reality is we keep doing it because people are downloading it. And I cannot believe, like, the person who spends their time listening to a dental hygiene podcast is obviously a unique, elite professional.
For sure.
And I am more impressed with you people than I am with Andrew and I, like, running our mouth on a podcast.
I'm not impressed by Michelle at all. And I really am impressed by you, the audience. And also, thank you for sharing it because last month, not that you guys care about the stats, Michelle doesn't even care about the stats, but last month was the highest downloaded month we've ever had. November, December were a little bit slower. So we were getting a little bit concerned, like, well, maybe we've peaked. But apparently that wasn't the truth.
We were not concerned.
Okay, Andrew. I was concerned a lot that we had peaked. And that was not the case. It was just the holidays or whatever it was. I mean, the whole industry was not doing so hot. But yeah, so thank you so much for sharing.
You just measure your success on metrics. And I think we really need to change that.
Well, I think I just need to take a step back and see a bigger picture rather than being so focused on the month to month. And rather than that, I can look at like quarter to quarter and things like that. Anyways, it doesn't matter. But I think it's time to read a couple of reviews.
Oh, do we have more?
So this is a 5-star review coming from Mandy M. RDH entitled Tooth Be Told. You need this podcast. A Tale of Two Hygienists is the podcast for every hygienist at any stage in their career. Michelle and Andrew stay true to their word and truly provide insight to all things hygiene with humor and enthusiasm. This podcast has the ability to reignite your profession for the profession, provide answers to questions you didn't even know you had, and you'll truly feel like a more well-informed clinician. I often find myself sharing information I've gained on ATalk with patients and colleagues. Whether you're a hygiene student, new grad, or you've been in the industry for 20 years, Michelle and Andrew will make you laugh, all while providing the most up-to-date, informative, and essential information for your career. Thank you, Michelle and Andrew, for all that you do for the profession of dental hygiene. I am continually impressed and inspired by you both, but mostly you, Andrew.
Did someone just ad-lib much?
Okay, I might have added that little part at the end, but I feel like that's what Mandy meant to say. But Mandy, thank you so much. Mandy is a friend. We know who Mandy is. She is amazing, and we think that she's awesome.
She's super great.
And
love, love, love. Thank you. That was very kind.
We have another one from Amanda RDH. The perfect way to avoid burnout. 5 stars.
Oh.
This podcast has a perfect way to stay educated on topics surrounding dentistry and life. I can take what I learn in each episode right into my operatory to help and educate my patients. I have been exposed to a wealth of information from experts that I never would have known without traveling across the world to CE events. This podcast has opened my eyes to all that is out there in our career field, and it keeps me excited to be in the dental world. Thank you, Amanda, so much for that.
Man, you know what? That's because she gets us.
She does get us.
The whole reason we started this podcast is because you and I were traveling and hearing these amazing speakers, and me being in South Carolina and you being in Washington State. I was like, why don't I learn this stuff where, like, if I'm not going to my state meeting, or if I'm only going to my state meeting, I might miss some amazing information. And so we just felt like that was a little insane, and we need to find a way to disseminate that information for free to you guys. So you are happier, healthier, more successful clinicians.
My guess is if this is the Amanda that I think that it is, and I am willing to wager that it is, and for Mandy, both of them are also doing really amazing things in the industry and sharing content, not our content necessarily, but their own stuff that they've created to help other people as well. So while I appreciate their kind words for us, like we could say exactly the same things about the both of you, just doing really amazing things in the industry. So thank you so much for leaving the reviews. So also shout out to our buddy, Denise. Denise sent Michelle a wonderful video that she loves so much. And
I did love it so much, Denise.
And she's going to friend request you back or accept your friend request.
I will. I'm so sorry. If anyone has ever friend requested me on Instagram or Facebook and I have not accepted, I apologize. You are one of many. I'm so sorry.
So let me back up the story. So Brittany, who works with our sales and marketing team, we went to Yankee for the conference, and Michelle unfortunately could not make it. So as we were going, we had met up with a company called VirtueDent, who, if you don't know who they are, you can go ahead and look them up, and you guys will be hearing about them probably in the future. They're doing pretty cool things. But Denise is one of their hygienists, and she's kind of forced us to be friends with their company single-handedly. She has a lot of passion for the
seems.
No, if you ask her, she'll be like, yes, I absolutely forced this. She is, and she's, I would say, a super fan. She loves the show. She was quoting things. She knew my drinks. She knew everything. It was really, really awesome.
Oh my gosh, that is incredible.
We went to an event with them, and then we ended up going to dinner with them afterwards with a couple of other hygienists, and they are just so smart, so educated, so passionate, amazing. Well, it ended up,
I love those people.
The next day we went out to dinner with Denise and her fiance too, and had a great time. She's just a very awesome, smart, talented hygienist. So shout out to you, Denise, and thank you for hanging out with me while I was in Boston.
And I can't wait to meet you in person. I love the video. Thank you. So let's talk about this month's series. So we're kicking it off with Sonya Dunbar, who is also known as the Geriatric Toothfairy. She actually just did a TED Talk all about saving our seniors, which is so cool. Congratulations on that. But what we're going to really kind of highlight this month, because if you haven't noticed, we're doing series since 2019 with these little podcast of ours. And we're going to highlight kind of how people are integrating medical and dental in unique ways. And you'll hear in this particular episode, Sonya she's going into nursing homes, but she's also talking to the team there that's seeing like the CRNAs, the nurses and stuff. So it's really a cool thing that she's doing. But we really wanted to highlight this true collaborative approach to get people healthier holistically. It's not beautiful. It's not perfect. Everyone's just kind of getting in where they can. And we're excited to highlight those with the hopes. I hope within my career, I can see true medical dental integration. I don't know if that's going to happen, but God, I hope. So I think this month is going to be very interesting. If this has been speaking to your heart for like many years, like it has for me personally, I just never understood why I couldn't roll up into a hospital ICU and help do oral care. But I hope I see that one day. So if that's been speaking to your heart, seniors speak to your heart, peds, going into OBGYNs, you're just going to love this month's series. And we would also love for you to share. You know, this podcast grew organically from the very beginning because you guys were out there sharing it on Facebook, sharing it on Instagram, sharing it with your colleagues. So keep on doing that. We appreciate you for that. And we do hope that you enjoyed this particular episode with Sonya Dunbar.
Hey, Michelle.
Yeah.
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine.
So listeners, I'm really excited to bring this entire month is going to be a series on just what it looks like to do things outside of private practice and very specific populations of people who need our help and need improved oral health. And Sonya Dunbar is just absolutely just dove into that and has an amazing program and company. And I don't even know if I'm describing that properly. Tell me what it is that you do and who are you, Sonya?
Well, my name is Sonya Dunbar, and I'm affectionately known as the Geriatric Toothfairy. So that's who I am, and that encompasses what I do. I serve the geriatric population.
Like you are in private practice or?
No. It's a twofold thing. I have a mobile dental company that's based out of Florida and Georgia. And I'm a national speaker. I speak in the country and out of the country about the importance of oral care for our greatest generation, which is our seniors. I also do a lot of training for nursing home staff, and I have a course for them as well. And I also have something called the S.O.S packages that people sponsor for seniors in long-term care facilities where they get a 3 to 6 month supply of dental oral care products like toothbrushes and tongue cleaners. So I have a lot of moving parts right now.
Okay, well, let's tackle those separately because that is very interesting. And I didn't know some of those things that you are doing. First off, you're a dental hygienist, yeah?
Yes. Proud. Yay.
Proud
30 years. 30 years.
That's impressive. I'm hitting 20 years in dentistry, but not hygiene.
Oh, wow.
And I can't even believe that's a number. When did you decide, like, as a hygienist, this is a population that really touches my heart? And I mean, have you always been in public health or did you also do private practice?
Oh, yes. See, I think that life takes stages. I think that there's stages, like when they have children where they're babies and they're toddlers and there's teenagers and then you're adult and then you're senior. So my hygiene career has been stages. When I first got out of school and my children were younger, I needed more money, I would say. I needed to do, so I worked in private practice where it was production based and I was a young hygienist and I was selling everything and toothbrushes and chips and irrigation and quadrants and even selling for the dentist. So I did do private practice. And then when my children got older and I could take more time to do what my passion was. That's when after my children went to college, that's when I got into the geriatric population. But it always has been a passion for me because I was, spent a lot of time with my grandmother. So I've always had a desire to work with seniors. And even when my children were younger, when they were like 5, 6, and 7, I would take them to the nursing home on Christmas Day and dress them up really nice. And they would sing for the seniors. So I've always had a passion to deal with seniors.
Aw, That is quite nice. So when you were doing your private practice, that was like kids, families, everything. And then, because for me, I found that I loved geriatric care because I was in perio. And that was a big population. A lot of them were aging and coming from the nursing home facilities.
Yeah.
They were like my kindred souls. I was like, the more dementia they have, the more fun I have with them.
Oh, you're so sweet. And it's strange you say that because I go to schools and I talk to a lot of students and a lot of the young hygienists, a lot of them are scared of the elderly people. They're scared of their like medical history and different things like that, reclining them all the way back. So I have to kind of break that down and explain it to them. So I'm glad you shared that you used to do that.
So that's really fascinating. And so they think because their medical history is complicated, they have a lot of medications on there. They're not really sure how to like approach that.
Exactly. Or even how to talk to them. A lot of them, the younger hygienists that are in school, some of them, because I asked, and they were like, I asked them what they like to work in the long-term care facility. And they was like, no, older people smelly and different things like that. They, in nice ways, they said it in a nice way, but basically that's what they were saying.
Oh, that's so fascinating because I'm always like, kids, gross. Like they're sticky. They're just full of bacteria. They stink to me. Like, I'm like, gross. The elderly, I'm like, yeah, I get it. Like complicated, but they're more fun for me. But I did have one experience when I was a student. So I'm just curious if when you talk to people, if they're still having this, in their curriculum. As we went to a nursing home, and we cared for a lot of those patients. But there was quite a few instances where we left feeling like we didn't even make a difference because no one was going to follow up with that home care again. Like we were there just for that rotation in that semester. And then after that, we were like, well, what was the point of that? Because a lot of like you said, the nursing home staff and team doesn't do a lot of home care or know much about home care. And so we all felt very disheartened after those rotations.
Exactly. And I totally understand that. And I want to plug this in here. If you felt disheartened after the rotation, I wonder if anyone would ever volunteer to go back and train the staff. I mean, if you feel something, do something. If you see something, say something. And that's what it takes, because in defense for nursing home CNAs, the certified nursing assistants who actually take care of the residents, a lot of them only get maybe 6 to 8 months of schooling. And the oral care part is linked with grooming, with cutting hair and cutting fingernails. So it's not stressed how important it is. So they're not educated like we as hygienists are. So one of my big things, and that's one of the reasons I'd like to speak to hygienists, because I'm saying, go back, give back, volunteer. I was in a room of hygienists and I asked them, who knows their local nursing home? Because nursing homes are nestled in our community. And a lot of hygienists didn't even know the nursing home within 20 miles of them. So I'm asking, as dental professionals, as nurses and CNAs, nurses and RNs and nurses and dentists and hygienists, to go back and train them. Volunteer. That helps.
Wow. So they are putting it in with grooming. So the oral care that can give,
absolutely,
or lack thereof, that can give pneumonia and
dementia,
painful abscesses, things like that, or it's in with grooming. And
it's just maybe one page teaching them how to brush teeth. It doesn't even talk to them about why oral care is so important. So I'm even rallying to get a whole chapter, at least one chapter in the book about oral care, how to handle the person with dementia, how to handle the combative patient, how to handle the person on a feeding tube. All of this, and tell them the systemic linked diseases, dementia, high blood pressure, diabetes, all of those are directly linked to poor oral care, especially in our vulnerable, frail population.
Like how many years into dental hygiene did you finally kind of move into this and start this company?
Well, now I've been doing geriatric oral care for the last 15 years. My company is 4 years old. So I worked with a company who had they were mobile dental providers and long-term care facilities. And I started out clinical, made it all the way to vice president of VP of sales. And then they downsized and let me go. So then I was forced to make a decision. And the decision was, either go back into private practice or do it, girl, on your own. And if you put me between a rock and a hard place, the hard place is going to lose because I'm coming out fighting. So I started I started my own business because I knew everything about it from being in with the other company for so long. And I just went door to door at every nursing home with my little pull-up slide and just asking them to allow me to provide care. And I got one nursing home, and then I worked that a year, and now I'm up to 20.
Oh, wow. That's great. Congratulations on that.
Thank you.
So I have a 2-part question then. When you are going to these nursing homes and offering a service, how do you define that service to them? Like, what are the things that you're providing in that service? And then how do you get paid for that?
Yes, we provide comprehensive dentistry. We have dentists on board that work for our company. We bill Medicaid and we bill private insurance, and we also bill the nursing home. So we have a lot of ways that we get paid. Oh, and when I go to the nursing home, I have my whole spiel, what I provide, what I do. We actually come in once a month. We provide oral care every month for the residents that's enrolled in our program. The people that are not enrolled in our program is because they choose not to be. And if they choose not to be, even if they need dental services on an emergency basis, we will provide that. But we do dentures, extractions, partials, fillings, cleanings right on site. But every month we do cleanings. We come in and we do thorough cleanings, and working and doing a rotation that they do need it. And we also call the families after every visit. We do in-services for the staff every month. And whatever hallway has the best oral care for the month, they get cookies shaped like teeth.
Oh, that's fun.
And it's a big deal for them because that hallway get balloons. We put plaques in the hallway. We do everything we can to motivate the staff. So we just become a part of the team.
Okay. Because in my head, what I've had, and as far as a platform or I guess an understanding of what you would do in a nursing home is something that Angie Stone has been doing, which is like going in a few times a week or once a week and doing oral care. But you're setting up to provide fillings and restorations, those dental cleanings, and then teaching that team at the nursing home to do that properly every single day.
Yes. Now, Angie Stone is my GIRL. She is my girl. We're kindling hearts.
We love her.
We're salt and pepper and for geriatrics. But yes.
So cute.
Yeah. But what Angie's doing is amazing because she's empowering hygienists to be able to go in without a dentist. Angie and I actually started out at the same time. I called her and she was like, I'm leaving dentists behind. I'm doing my own thing. You know, she between a rock and a hard place. That hard place is coming down. She's like me with that. So the high life is amazing, but we're doing two different things. So, but I admire what she's doing. It's so effective, but we go once a month and we will leave accountability cards in the resident's room where the CNA has to check when they provided care. And we're doing comprehensive dentistry because it's so much work that needs to be done on our seniors. And to go in there and just, clean their teeth and I see they need fillings or extractions. We have our dentists right there. Our dentists go with us every month and they just do what needs to be done. So it's a different setup. Yeah.
Yeah. No, I love it. So how hard was it to find a dentist to work with you and go and do this type of care?
Not hard at all. I know some amazing dentists.
That's fascinating.
And it's all about relationships. Mind you, I've been a hygienist for 30 years. So I have great relationships, but it's just about relationships. You have to find the right people. It's only a certain type of person that's going to work with the geriatric.
Because I asked that because I'm in South Carolina, I'm in Charleston, and we are having a hard time finding dentists to come provide care, especially with a Medicaid number, so that they could even do teledentistry. And for a lot of our populations that are in need of dental care, it's a real struggle for us right now.
And have you tried the dental schools?
Yes, actually, I'm in an outreach program right now that has direct, like the residents and the students come and provide care as a part of their curriculum, which is fine. And like, it's filling a need for sure. It's like those after hour times though, that we are really struggling to find people, and also for our mobile units too.
But what I mean for dental schools, sometimes you get dentists right out of school. And I've had some very good luck because some of the dentists that I have, if you're providing care for the indigent population, that helps them pay back their student loans. So yeah, I've got a couple of dentists doing that. So, dental schools, retired dentists. I have retired dentists that came out of retirement because it's not really hard work and it's not a rush and pressure. There's all different type of areas, but see, I live in Florida, so I have a lot of dentists locating to Florida that's retired. So yeah.
So my other question though is, when you're going in and teaching your teams this and you're holding them accountable, the staff members, the CNAs, did you have any challenges with that and any pushback when you first got in there?
Yes, there's always challenges, but I think it's all about how you approach it. And what I notice is I always approach as a team player. I don't ever put myself superior or know all or anything. I'm on your team and we're here to save these residents. And this is what we gonna do. I'm right in the ditches with you. I'm walking around with you, helping you brush teeth, telling you why it's important. And then this is the secret. I talk to them about their own teeth, their own oral care. I have my dentist looking at them. And sometimes they even come to my dentists who have offices. They come to their private practices. So when you let someone know their problems, they're more aware of other people's problems. Does that make sense?
Oh, absolutely.
And some of my CNAs, they come up, they're like, Sonya, I got a deep cleaning, or I got this done. I have a crown. So they're excited to share once they're educated. When people know better, they sometimes want to do better. Maya Angelou.
I love that. Yes. Be the change, right?
Yes.
So I guess I had that question in my mind because I had a different understanding of what you were doing. And now that I understand that you're doing comprehensive care, is that like you are bringing that resident out of their room and into a mobile van? Or do you have a setup in that facility? Or are you doing it right there in their room?
All of the above. We have a van.
Oh, okay.
We have a chair, a special chair. And sometimes we have to go to the room. Being with geriatrics, there's two things you can't do. You can't give them an appointment because you don't know what that's like trying to give an infant an appointment when they're going to eat. An infant's going to eat when they're going to eat. So you can't give a geriatric person an appointment because if they're eating, whatever, you just can't give them an appointment in the building. And then some of them don't get out of the bed. Some of them do get out of the bed. Some of them we take people to the van if they can walk and get in the van and sit there. Then we take them. Some of them are in jerry chairs. So it depends on the circumstances. But for the most part, we actually set up in the facility because of liability. I'm not comfortable taking people out in a van if somebody fall or anything. But if the dentist has a long procedure, if he's doing a complete extraction, getting ready for a denture, of course we do that in there. But for the most part, we usually set up in a room that's designated from the facility. Everything, is mobile, So that's the most used part.
And so when you go and you're doing quote unquote cleanings, is this just hand scaling or are you using ultrasonics? Like, what does that look like?
Yeah, we have ultrasonic. We hand scale. We have our, the cordless Profeer angle. I'm actually not in the field a lot anymore, unfortunately, because the company has grown so big and I'm doing more clinical. And of course, Melissa Turner and I are getting ready for our big national mobile dental conference. So I'm speaking more, but we do a lot of, we have everything that's in a dental office. We have the Cavitron, the Pedizio, what is that called? Pedizio? The Piezo, yeah. I love that thing. It has a little light on the end. And so we have all of those things, yeah.
Okay. And when you're treating patients in this geriatric population, what are some of the more frequent diagnoses that you're seeing? Is it like decay? Is it perio? Is it needing an extraction, I should say? What are some of the things that you're seeing most frequently?
The most that we see is, in my opinion, is poor oral care. And most of them need their mouth clean, so that's the biggest thing. And the plaque and the food and, dentures not being removed. Like I spoke before, I removed dentures with mold on them. One lady had been in a nursing home she was at home with her sons. They were caring for her. DCF took the mother from the sons because of neglect, put her in a nursing home. The sons, nor the nursing home, knew she had dentures, and they had been in her mouth for over 10 years. And it took us
wait, what?
They hadn't been removed in 10 years.
The dentures?
Yeah, and it was like ingrown.
Oh, my.
They were like ingrown into her gingiva, and it was the most horrific thing that we'd ever seen. And when we removed those dentures, it was like hamburger meat. Jesus help us. I mean, some of the things that we see is deplorable. I'm screaming from the highest mountaintop. We need to bring awareness to our seniors and long-term care facilities because it's like they're a forgotten population and it's making my heart break. And it's just horrible. It's horrible.
I had on one of my rotations, a geriatric woman who hadn't had her denture removed. And when I went to try to take them out, she would try to bite my finger.
Yeah, you get bit now.
And everyone's, it happens. And I'm like, well, and that's why everybody's like, well, that's why I don't deal with geriatrics. I'm like, well, kids have bit me too. So I
kids will bite and kick you.
I take this person and the reason that she was trying to bite my finger is because no one had taken out her denture. They didn't even know she had a denture. So her mouth was so sore, but she couldn't verbalize that to us because she wasn't able to speak and tell us that that was her way of like, don't touch me. This hurts.
Right.
So I can't even imagine what that poor woman was going through. And the fact that people look at that as like, well, it's fine, just leave them in, which I've heard before. Like, why do if they're there, just leave them in? I'm like, would you want their shoes to stay on? Like,
that's what I compare it to.
Like, where's the line, guys? Like, why would you give more attention to someone's toes that are about to have gangrene, but not their like mouth? That is, I mean, I don't even know how they weren't septic at that point with like abscesses and disease and oh gosh.
And then, and to your point, Michelle, I tell people all the time, the mouth is the window of your health. If you think about it, when you go to the doctor, he looks in your eyes, your mouth, and your ears. You could tell a lot about your health just from your mouth. So if someone's mouth isn't healthy, their whole body is not healthy. That's just how it adds up.
Actually, I think one of the products that you and I both love is Dr. B's Dental Solutions.
I love Dr. B. He is my people. I love Dr. B.
Yeah. And I found them a few years ago at a denturist meeting, actually, when I was exhibiting for another company. I was like, oh my gosh, this is great. And so I started my grandfather on it. Are you using their like crystals for the dentures?
Oh, yes, absolutely. 110%. I have some of I've had one hospital order the product for every one of the residents there because I really like the Clean a Dent toothpaste because it, helps with staph and dry mouth, which is huge. Everyone in a nursing home almost has a dry mouth because of the medication and the lack of water. Most seniors are dehydrated. So I love it. I love his adhesive and his new denture wipes. So yes, and Dr. B and JP, his son, are just amazing people. They're passionate about their product. Yeah.
So for the audience, one of the things that I like is that when you put the denture in these like crystals or the liquid that goes into the denture kind of jiggler or soaking it, it was sanitizing it.
Yes.
So you could take it out and it was killing, I think it's PG, was it killing or no? Strep mutans.
Strep mutans, yes.
And so it's actually disinfecting that acrylic.
Absolutely. And it has vitamin A, D, E, and tea tree oil. So it's natural products. So yeah, I love his products. Dr. B is a fan. He's my fan. I'm his fan, I say.
Yes. And so when I started using them on my patient or my grandfather, he had 2 implants that were locator attachments for his lower denture, and he had a maxillary removable. And I could use that paste and actually brush the ridge of the tissue because it's so there's like no abrasivity to it. It's really kind to the tissue, and like you said, it has vitamin E and tea tree oil. And he found it very pleasant because a lot of food would get stuck underneath there and create that almost that material, that material alba on the ridge. And so I could scrub that off, which most people don't do this. They pull the dentures out and scrub the tissue.
Yes. And believe it or not, a lot of nursing home people, they just take their dentures out and put them in a cup. They don't even brush them. And then they put them back in their mouth in the morning with all that food in it. So I just don't know. It's just.
That's rough. So when you go to nursing homes and you do in-service, like what are some of the things that you're focusing on? Is it the oral systemic connection, or is it the pain, or is it a little bit of everything with them?
Oh, I have 17 courses from diabetes.
Oh, wow.
Yeah, it's a whole series. As a matter of fact, I just finished, I have an online course that's just for nursing homes that a nursing home could buy for new residents when they enroll. So not new residents, for new staff. So it's for new staff, and it's a accredited course, and Once they complete it, they get a certificate of completion because it's such a high turnover rate. So to answer your question, I have at least 17 different topics that I talk about, and I just rotate them around because there's always new people. And then by the time I finish one, we have a whole new batch. By the time I finish one set of 17, it's a whole new batch and I start over. One of it is about how to handle the difficult patient, how to handle the patient with dementia, oral care as it relates to high blood pressure. And it goes on and on from there.
Do you have any suggestions for us that are still seeing patients in private practice that are geriatric and difficult? And I say that quote unquote difficult because that's probably different for everybody. I think they're adorable when they get all cranky.
Yes. One thing that I would say for the geriatric patient is to schedule more time. In private practice, we're on a tight schedule. So I would make them the first person or the last so that you could take that extra time to review. And one thing that I would like for people in private practice to do, and this is a stickler, if you have a patient that's geriatric and you don't see them in a while, look for them. Because a lot of times they may have moved to a long-term care facility from their home, and we want to be able to follow them and make sure that they're still getting that care. So just if a patient just doesn't show up and Mr. Jones just doesn't show up for a while, just doing a little inquiry and say he hasn't been here in a year or two. He may be in a nursing home, and maybe your dentist may let you go in there and brush his teeth there. That's something that Angie really promotes. There's someone, if you're interested in following through with that, just definitely get in touch with Angie Stone and she can teach you how to do that.
That's a good point. And I do bring this up in my implant. So I have a 4-hour course on dental implant maintenance. And one of the risk factors is placing implants on patients who are geriatric, and not a contraindication, but a risk factor, because if we are not able to maintain that for the life of that implant, which is the life that it's in that person's jawbone, and if they die with it, it's still kind of our implant that we need to follow. And if we aren't setting them up for success, it becomes kind of a liability. So I always ask the audience, who has a plan for when that patient can no longer come to your office? What are you going to do when you've placed that hybrid, that fixed prosthetic when they were 70, let's say, and now they're 82 going into a long-term care facility? Maybe they fell and broke their hip and they can't come in. What's your plan to reach that patient population? And no one has a goal or no one has a plan. So I'm always encouraging people, when you have your monthly meetings, put that on the list, have a conversation, find the people like you and Angie in your area that you can maybe partner with, or set a day aside that you can just knock out some of these patients that are in these long-term care facilities that need your help, or utilize teledentistry to be able to see those patients. But I always ask, and no one has a plan. And I'm curious, how many times are you seeing patients in short-term care? Because that was also an issue that I struggled with. Was a patient fell, broke their hip, for instance. They were in the hospital for X amount of days, not getting oral care. Then they went to short-term care and were not getting proper care. And then they went home. And so they were still coming back to see me. But let's say that happened in that 6-month window. Maybe they got their appointment with me. 2 days later, they fell and broke their hip.
Yeah.
They came back and saw me 6 months later, and they were a wreck. They were a wreck. And I had their perio under control.
Oh, that makes you mad.
I was like, what is that? What happened? So how often are you seeing patients in short-term care?
Thank you for asking that. Now, in nursing homes, all long-term care facilities have a short-term wing. So while we're there, if someone requests to have their teeth cleaned, we'll do it and we can bill their insurance. But normally it has to be a request from the resident. Other than that, we will not. Okay. We hardly ever go to the short-term side, because a lot of times they're rehabbing, and those people, they're not engines it. They'll tell you, I'm going to see my own dentist. They don't even want to be affiliated with living in a nursing home. You're
right.
They let you know I'm not.
They're honoring it.
They'll tell you I'm not these people. That's what they'll say. I'm not an old person. So hey, they want you to know that they're not there for the long haul.
So would you be doing in-service for those same CNAs though that are working in the short term so that at least they could say, are you brushing? Are you caring for your mouth today? Those kind of things.
Yeah, we do CNAs we do in-service for all the CNAs that's in the building.
Okay. So tell me a little bit more about your S.O.S. I want to know, like, is this a nonprofit? Like, what is this?
Yes, it's affiliated with my nonprofit organization, and it's called the S.O.S program, Saving Our Seniors One Smile at a Time. I'm sending out an S.O.S, and it's a package. I wish I would have known I would have had one here, but you can't see it anyway. But it's a package that people can go to my website and they can sponsor a senior. And we've targeted seniors that live at home, that receive Meals on Wheels, who cannot afford oral care products. And we targeted seniors in long-term care facilities. But the S.O.S package is amazing because inside it is an accountability card for the CNA, the certified nursing assistant, or the resident to check when they provided their oral care. And it's 3 to 6 months worth of toothbrushes, tongue cleaners, dental floss, and things like that they need to take care of their teeth. So it's great. And I also give them out because I speak twice a month at the local community centers here, and I give it to the seniors there when people sponsor them. So that's something that God put in my heart to help save our seniors, to get the package, to get them the materials. I talk about it, but if they don't have the supplies to do it, they can't do it. So that's why I have the S.O.S packet, and I'm so excited about it. Like I said, this summer, I was able to take, I think, 50 S.O.S packages to the Bahamas where people had been evacuated after the hurricane. So it's just been a great program.
That's awesome. And we'll have a link in our show notes so that you can learn more about that. So as far as products go, how do you have to adapt? Because I would imagine flossing is a bit difficult as a caretaker and also for geriatric with like arthritis and issues with like wrapping it around their fingers. Are there specific, and you don't have to give name brands, but just like an idea of like, what's types of toothpaste? Are you looking for toothbrushes with bigger handles? Are we looking at electric versus manual? Like, what does that look like?
Well, to be honest, now everybody that's on my program, they get an electric brush. If they're on my program, we get them an electric toothbrush and we change the heads every 3 to 4 months. If someone if they have dexterity problems like arthritis, we do provide the big handles from Oral Bright. That's one of the people that I partner with. They're amazing. Other products is I like the Remy Pro from Vocal, and that's really good for the sensitivity because in the dry mouth. And of course, Dr. B. As far as flossing, the floss picks are amazing. The floss picks with the little handle and the floss like a little hook or something, and then this regular straight floss picks work well. The little Christmas trees, I call them, those are great. But you're right. Flossing, unless you know how to do it, is hard. So when I train the CNAs, I try to encourage them to use the floss picks or the little Christmas trees, because a lot of times they're in a rush and they can jam the floss down and they can do more damage and cut the gums. And if someone's a diabetic, it could go south real quick. So those are some of the products that I really like. I'm a big Crest fan. Crest is a big thing for me.
And what are some, I guess you're billing and you're doing codes and everything because you're billing insurance and Medicaid?
Yeah. Yes.
That's all the same?
Yep. We have a whole billing company, marketing company. We actually are in a dental office for our home office. So yeah, we have a dental office that is our home office. It's located in Georgia. And we work out of there where all of our supplies get delivered. But our dentists, they come from their private practice. They come from their homes. But we have a central location office.
Okay, that's very nice. When do you find geriatrics need the most care? Is it is it diabetics? Is it post surgery? I don't even know if that's a relevant question, but I'm just curious if there's a very specific time in their life. Like if we know, maybe we start to see some mental decline in our private practice with those patients, or we know that they are just post-op of a surgery. Any particular time in their life where you're like, we really need to keep a close eye on our geriatric population?
Let me tell you, if someone comes to the office and they bring their child with them, most of the time it's their daughter. if they come in with their daughter and you ask the resident, you ask the patient something and they say, well, ask my daughter. Or if you call and the daughter's, those are signs when they're not driving themselves to the dentist anymore. Those are signs when someone's with them. And, so those are things to pay attention to when they're not doing their own anymore. So that's a sign.
Angie Stone taught me a really good thing that actually has stuck with me. And it was when you have a geriatric patient and they have a removable partial or denture, to not put it in their mouth for them, but let them do it so that you can see if they still have that cognitive function to remember how to put it in their mouth. So for instance, if they try to put it in backwards, that's kind of like a sign like, okay, their cognitive decline is pretty serious. Mm-hmm. And when she told me that years ago, I was like, I just don't think that's going to happen. Or like, that'd be really interesting. And I was coming from the perspective of my own grandfather, who I've been caring for years, who had a max denture for 40 plus years. I was like, he's never going to put that thing in backwards. And the week that he died, I gave him back his denture and he put it in backwards.
Oh.
And I was like, oh, that was an eye opener. I was like, wow. You knew his mental decline was pretty bad when he, after 40 years, was putting a denture in backwards. He couldn't figure out which way to put it in his own mouth. But I thought that was a really great tip. So now with my geriatric population with that removable, I give it to them versus putting it in there for them.
That's good. That's also good. Yeah.
Oh, scope of practice. Is that different in a mobile unit? Or if you were going, because your setup seems very like, it's just like taking a dental office and moving it around. But if somebody were to get started with going and volunteering or creating something where they're just going to polish or brush teeth, what do we have to be concerned about with our scope of practice or our with our dental board, getting in trouble with them? Do you have any suggestions for that?
Yeah, you'd have to know the laws in your particular state, which is easy to find out. You have to know the laws in your particular state and what's required there, because mobile dentistry is so new that a lot of the laws haven't been put in stone yet in a lot of states. So there's a lot of gray areas there that we could help you with at the National Mobile Dental Conference. So we're going to be giving out a lot of information.
That's January?
No, it's February 28th and
February
of 2020. And so we're going to have a lot of information about that at the National Mobile Dental Conference. So, but you'd have to know the laws of your state. And I want to be honest, it's a little difficult if you don't know how to use the proper verbiage, because I knew, but I've gone and I've helped other people set up and they just, like one young lady in Boston, she had bought all of these supplies and she was like, I don't know what to do. So I went to help her, and it was just a few things like HIPAA and things that we had to plug in, and she was ready to go. So there's certain things that you have to know. And that's why Melissa Turner and I have formed this organization, the National Mobile Dental Association, and the National Mobile Dental Conference. Is going to be great.
That actually brings up a good point. What does HIPAA look like with these elderly geriatric patients? Because I'm sure you're talking, of course, with medical staff, so I get that a little bit more. But what about like family members, and how do you navigate that?
Oh, you have to get consent. Just like if they're not their own responsible party, if they don't have their right state of mind, you have to get the consents from their responsible party. Some of them are wards of the state. Some of them have children. And you got to think about it like this. If I'm dealing with a 90-year-old man, his daughter may be 75 and she may have dementia too. It takes a lot of patience. This is something that you have to have a heart for. Now, I'm going to be honest with you. It's a lot of people think that geriatrics is a field that you're not going to make any money in. That's not true. If you know how to do it and do the proper billing, you can make money. But it can't be about the money, because the money is going to be hard earned. It's a lot you're going to have to go through. Families, children, adult children fussing at you, being fought, dealing with nursing home staff who don't understand how important dentistry is. It's just a lot involved there. So it's not easy. It has to be something that you want to do.
Thank you for bringing that up, because is there a certain personality type that you see a lot with mobile dentistry or geriatric care?
Yes, for dentistry, it has to be someone like me. When my kids were young, I've always been an entrepreneur because my kids are right now, they're 24, 25, and 26. So at one time they were 1, 2, and 3. So out of my hygiene career, I stepped out for 7 years and opened up a daycare. So I had kids. So then because I was doing so good, I went from one daycare to a chain of 7. Yeah, so I had 7 daycares, and I was
a serial entrepreneur.
Yeah, and I had over 700 kids that I was responsible for. And then I went into a school that dealt with kids with IMEs that went up to the 8th grade. But I said that to say this. You have to have, I think it's a person that have a desire to care for the underserved. Because some people don't have the desire to put their hands on the underserved, but they may have a desire to give checks or money. But you have to have that compassion in your heart. You know, when you see somebody that's trying to struggle to get across the street, you want to go back and help them. You know, it's something I think that you're born with, you know, especially with the geriatric, because it's, you know, it's all type of smells, it's all type of everything in those nursing homes. So you have to be ready for it, you know.
That's such a good point. No, I think that was a great example of, like, if you see somebody crossing the street, you want to go help them, or do you just keep on driving by? Those are the two types, right? Like,
right. And there's nothing wrong with either one. Don't feel guilty.
Right. Absolutely. I'm curious about health history. When people are really concerned about, I don't want to go in there because of the health history, is it because of the medications? They don't want to remember, like, what are the contraindications of medications? Or is it because they have, like, feeding tubes and more like the medical devices that go with the person?
Are you talking about a hygienist in private practice or the CNAs?
No, both then. Maybe both.
Well, let me tell you something funny real quick. When I was training some of the CNAs at a particular nursing home, one of the young girls said, "Oh, I don't brush their teeth because their gums bleed." And I was like, wow. So I had to kind of educate her on that, you know, they're bleeding because you're not brushing them. Just keep brushing, you know. So, and I think maybe in private practice, when those young girls are in school and they were saying that they felt uncomfortable caring for the elderly, I think maybe they breathe funny. They're older. And if someone doesn't have daily contact with someone, it can be intimidating. You know, you think about a dad with a new baby. He's not used to holding children, so he's nervous. So I just think that people are afraid of the unknown, you know, and some older people.
So it's really not the medical history. It's not because you learn those things. Like, you can learn the difference in blood pressure pills and diabetic medication and all of that, but it's the fear of the unknown. That's a good point to
make. And think about it like this. If you have an elderly man in a chair and you lay him back and he has a heart problem and you don't know he can't lay back that far, and then he starts breathing funny, you panic, you know. I had a dentist when a lady started choking or some water we sprayed in her mouth, she started freaking out and started crying. I was like, "Doc, she's still coughing. Let her cough it up. When she's not coughing, there's a problem, you know?" So, right, you know, but she started freaking out because the lady was coughing, tears running down her face, you know. But she was an older lady. She thinks she was going to cough and die. I actually had a lady that died where I was working with her. So it's all type of things with the geriatric. So, yeah.
Wow. That's pretty scary. I can imagine. So as we kind of wrap up the last few minutes of this podcast, I would love to hear any advice that you might have for new grads, someone maybe still a student, or maybe even the veteran hygienist that they're like, yeah, I'm burned out with private practice. Like, the business side of it, it really has, worn me down. And I would love to get into the public health geriatric population. Like, where's a good starting point for those people?
Absolutely. I think a good starting point for public health, if you want to try it out, is to volunteer. Go into a nursing home or into a daycare. Because don't forget our kiddos. Go into a daycare or a school and volunteer to educate on how to brush, and the staff, and you could even educate the residents. You can go to the activities director in a nursing home and ask them if you could talk to the residents, and they love it. They love to see people talk to them. So I think just volunteering, if you're a veteran hygienist and you're just tired of the pressure of sales and you want to try something different, I think or geriatrics is good. And now I'm not going to say coming in and cleaning teeth is good because you're bending over all type of way. The way your body moves is horrible, but maybe coming and doing some training and educating would be great. The new grad, if you're interested in doing something different and if you have that heart, I think reaching out to me, Angie Stone, or someone that's in the geriatric population and let us help you get plugged in somewhere.
That's a good point. I think always like what you're saying, this national mobile dental,
The National Mobile Dental Conference.
Thank you. What a great place to go learn and network and even learn if that's even a good place for you.
Absolutely. Absolutely. And right now we even there's a contest, I think it's Mouthwatch is doing a contest right now for free registration.
That's awesome. Are you using teledentistry during these appointments with your patients?
Well, I take dentists every month. So I don't have to use teledentistry because every time we go to a facility, our dentists go with us. Just because I want
That's
that
great.
there. I want a dentist to look at my patients. I don't have to because in Florida there's indirect supervision, but I just like my dentist there. And the residents love it. It's just making their lives better.
Okay. I was just curious, but yeah, we love Mouthwatch. So I think that's a great meeting. I wish I could be there. I'm actually scheduled to speak at a different conference, but I love the idea of this National Mobile Dental Conference. Like, sounds great. Any other tips, tricks, things that maybe we didn't touch on that you wanted to tell all of our listeners?
I would like to tell everyone, if something I said resonated with you, just follow that little nudge in your heart. Even if you can't do it now, just don't avoid it and just look into mobile dentistry, to geriatric dentistry or pedos or special needs. All of those are great opportunities. I'm also going to be on TED Talk on January 25th, and that's going to be really big for the dental geriatric population because that gives me opportunity to have this go viral and bring more light on the geriatric population. So I would like to ask anybody who can to just tune in and watch my TED Talk and help it go viral.
Oh, that's great. Congratulations. When is that? January. Well, actually this podcast will be out after that, but we can put that in our social media.
Thank you.
I'll make a note of that. What day is it?
January 25th. So that's when I do it. So I probably won't have the link until maybe January 30th.
All right. Well, we'll try to make that go viral and support a fellow hygienist.
Yay. Let's get it viral and just get more platforms for geriatric oral care because we need to bring awareness to this because it's deplorable. Michelle, you know that. But thank you for allowing me to be on your show. Oh,
gosh. Yes. Thank you for coming on. And I really do think that this will resonate with someone. And if, kids do, like you said, they get I don't want to say a lot of attention because we got children out there that are really underserved as well. But you do hear more about like getting kids dental visits and going into the schools and as far as like the public health side of things. And I don't hear as much about the geriatric community.
It's a forgotten population.
Like, why does it even matter? They're going to die. And I've heard those words come out of someone's mouth before. What's the point? They're 80 years old. Who cares?
That's so mean. That's so mean.
It's so mean. And God, you're going to be there. You're going to be there one day.
And, someone posted that on my Facebook page one day. I was like, ugh.
No. Yeah. Well, thank you for your time. Thank you for all that you're doing. Thank you for leading the charge in this and really bringing some awareness. And what are some of the contacts or places they can find you, websites, all of that jazz, so our listeners can connect with you?
Thank you. Definitely geriatrictoothfairy.com. No, geriatrictoothfairy.org is my website. Definitely plug into my website and I'm on LinkedIn, Geriatric Tooth Fairy, Facebook, S.O.S, Save Our Seniors, join my group. I'm on all the handles, Instagram and what's the other, Twitter, and Facebook. So
Twitter, yeah.
Yeah, I'm on everything.
And is S.O.S Save Our Seniors. Is that a website or is that a Facebook page?
That's my Facebook group, SOS Save Our Seniors. That's my Facebook group. I just rather people just join the group, because who really, if you have a group, who really goes to that page anymore? And then, my website, geriatrictoothfairy.org, and all my other handles, LinkedIn and Twitter and Instagram.
Perfect. Well, thank you so much for your time, Sonya. This was fantastic. I love chatting with you. Your passion is contagious. And
thank you.
Keep on doing it. We appreciate you.
Thank you.
So Sonya is fantastic. Congratulations again on your TED Talk and all that you're doing. I love her model. I love that she's in it for the love of the seniors.
Yeah.
So great.
Yeah. That's amazing. And I love someone who has just that much passion about anything in particular. Like, it is so compelling.
It really is. And so, like, not just like she's passionate about it, but she is just a vibrant, energetic human being when you meet her. So that's always fun. And also her husband is the best. Do you remember meeting him?
Yeah.
At the booth at RDH. I think it was RDH Under One Roof.
Yep.
He's like retired military, and he's just like super supportive. He's precious. And man, I love a power couple. Nothing makes me happier than a power couple.
Yeah.
Relationship goals. So anywho,
you would eat your power couple relationship person alive.
My relationship goal is Ruth Ginsburg, Bader Ginsburg. I always say it wrong.
That's right the first time.
RBG.
Mm-hmm.
Have you seen the movie?
I have not seen the movie.
Watch that documentary. It's not a documentary, I guess. It was actually like a featured film, but it's so good. I want to be Ruth, and she's just a little firecracker, and I love it. So that's my relationship goals. But also don't bank on me being in a relationship with anybody. But
there it is.
Lola.
The Black Widow killing her mates one at a time.
Can't help it. Can't keep
relationship goals.
All right. Well, this turned into Michelle's therapy session. So we're going to be going to Chicago Midwinter at the end of the month. Then I will be at ICOI ADIA in Houston. I'll be speaking there. So if you're going to that implant conference, you should find me there. But also, if you're going to Chicago Midwinter, we would love to have fun with you, meet you, shake your hand. Andrew loves to give the hugs.
I do.
And I'll be hopefully hosting a trivia event. I'm not sure if it's going to be Thursday or Friday, but we'll let you know. And you can come and win some money.
Right.
And Andrew's already won. Like, he's taken
a
home
crap ton, everybody. A literal crap ton. Figurative crap ton.
Yeah. Let's hope it's not
literal. Trivia doesn't pay out in crap. They pay out well.
He's on Amazon gift cards at the moment. So head over to triviadent.com and you can start playing. You can have 6 winners now. As of 2020, we have 6 winners every month, not just one. So Andrew's not the only one crushing it. And remember, it's not national boards, guys. This is trivia. So some of it's good, some of it's fun, some of it's silly, some of it's sciencey. Yeah. It's all over the place.
For sure.
Try it out.
So I think also, if you're interested in being on the podcast, Thursday and Friday of Midwinters when we're planning on doing some recording. So please reach out early so that there's still some spots left. And then after all of this, after the February, in March, we have Hinman.
Yep. So I will be at Hinman with Brittany, our lovely sales marketing person that makes our life so much easier. I wish Lacey could come, but I'm sure she's working. But we love Lacey too. Our little small, mighty ATOF team. So we'll be there. We'll have a podcast booth. It's going to be so great. We're going to be repping the hygienist at Hinman meeting. And I'm actually really excited because this is going to be my first Hinman.
Yes.
I can't even believe that.
Well, we've heard so many great things over right? Yes. Like everyone that we know goes there and like, hey, this is a great big show, good networking events, quality CE, like top quality CE down in Atlanta, Georgia. What's not to love?
Yep. I'm really excited. I'm happy that I can drive there. I just can't believe this is my first one. I'm always somewhere else.
Right.
Always something else going on. So that will be exciting. So if you're going to be at Hinman or you're thinking about going to Hinman, you should. And you should come meet me and Brittany there. We would love to see you. I might have a little goodie something for you.
Yeah. And that's March 19th to the 21st. You can find more on their website.
And if you are also on any social media, you should be following us on Facebook, on Instagram. We're also on LinkedIn. And if you want to reach out and talk to either one of us, you can do that by sending us an email either at taleoftwohygienist@gmail.com or separately, Michelle at taleoftwohygienist.com and Andrew at taleoftwohygienist.com. And you can go to our website. And on our website, taleoftwohygienist.com, you can send us a voice recording. So if you want to leave us a review with your own words, your own voice, you can do that there. And if you ever want to be on the front part of this good old podcast where we say, get ready for your unofficial dental hygiene podcast, you can do that and tell us who you are and what you do. We'd love to put you on the podcast. So do that over at taleoftwohygienist.com.
For sure.
Anything else?
No, I think that's it. That's been a good week.
Yeah, I agree. All right, guys. Everybody have a great week.
Bye, everyone.
Bye, y'all.